The acute admissions unit was opened last March with 120 beds, which is the biggest in Europe. And all of the A&E services that were previously provided on 2 sites are now solely on the Watford site. So there's the added pressure of all that acute work now coming to Watford. It's all urgent on this site. So the Pentra SAfe solution has really provided us with an ability to achieve the results that we need to achieve in the laboratory. We decided that we wanted to go down the route of having a full 5-part differential. So we were looking at instrumentation which provided that, and the HORIBA machine looked very good. It was nice and compact. It fitted in the environment that we needed it to fit in, and it was relatively simple to use. The HORIBA machine is, it's been really good. The medics in A&E rely on it now as being as good as the laboratory analysers, and everybody's happy.
We've seen so far that patient results are available more quickly, means we can get on and treat the patients more quickly. I mean, there's a number of patients where the decision on whether to admit or discharge a patient will depend on the result of a blood count. We can identify those patients that can safely be discharged with oral antibiotics, for example, and send them home much more quickly than we could otherwise. Because
we're such an acute trust now, the expectation of the laboratory staff is so high to turn all results around rapidly, and the introduction of the full blood count machine in A&E has actually taken the pressure off the laboratory staff. We've trained over 100 staff in the A&E department, and now they're all very confident in using the instrument. Our body for accreditation, which is clinical pathology accreditation, now have some very strict requirements for point of care instrumentation. I can see who was using it at any particular time. If an error was made, then I can report back to the person who made the error, and I can retrain them. And we can log that again for CPA purposes. Error logging is very important now, so I can refer back to the person who did it. I can say they were retrained, and CPA are happy with that. And I do think it's the future. We're continually being hit with targets, with turnaround times. Our key performance indicators in the department need to be realised, and that's the only way forward as far as I'm concerned.